This simulation, or enactment of a medical assisted death, is being staged in an intentional way to convey information, increase understanding, and to stimulate dialogue. As such, it may not stay true to time or to place, and our performers and myself will be invited to consult our scripts so that we can make sure we don't miss anything in our attempt to portray the snapshot of what the current state of MAiD is here on Vancouver Island. Given the import of this topic, in advance of your participation, we'd like to share the following thoughts for your consideration. This presentation is focused on medical assistance in dying, or MAiD, and we view MAiD as compatible with a fulsome palliative care approach. We do not privilege any means of death as superior to another. For some, the language of death and dying is uncomfortable. Please be mindful of this. Independent of individual or organizational beliefs and values about death and dying, the current Canadian medical legal context allows for MAiD. And while there may be some of those who have disagreements with portions of the current laws, or in fact have fundamental disagreement with the legislation, at this event, we will consider MAiD as an enactment of choice and an expression of free will. And what is acceptable for one is not necessarily acceptable for another. This is the nature of choice and the nature of autonomy. We're not here to debate the ethics of MAiD this evening, only to convey information about what MAiD is and to stimulate thought and discussion. So, thank you again for coming, and we invite you to share the evening with us and to approach it from a place of respect, of genuine curiosity, of non-judgment, shared fallibility, and lastly, positive mutual regard.
My name is Helen. I have metastatic breast cancer, but it could be a host of conditions. There's no more active treatment they can offer me, and I have been working with a fantastic palliative care team for a few months now.
My name is John. I'm Helen's husband and her main support. I could also be her brother, father, sister, mother, friend, adult child. We have 2 adult children and 1 grandchild.
My name is Dr. MAiD Gill. I am a new family physician, and I recently took over the practice of a retired colleague. Helen has a diagnosis of metastatic breast cancer and has been working with the care team throughout her entire journey. Right now, we are focusing on palliative treatment options to help her feel comfortable and maintain her quality of life.
One thing we haven't talked about is how much time I have.
Well, Helen, we can't really be certain, but what we do know is that this is end-stage cancer. We do have some options. We can continue with the palliative care approach, either in your home or on the care unit. And our goal, as you know, with palliative care treatments is to help you be as symptom-free and really as comfortable as you possibly can.
I know we can continue doing what we're doing now, but it's important for me to look at something else. And I've heard about that thing where the doctor can help you, die peacefully.
Okay.
Really? I mean, would you consider that?
Well, yes. I mean, I'd much rather go under my own steam than to painfully fall away piece by piece.
Well, are you sure about this? There's so many things to consider. What about the kids?
John, relax. I'm not doing it tomorrow. We're just talking right now. Is it an option?
Yes, medical assistance in dying, I think is what you're referring to, or MAiD, is an option, and it's legal for you. The main criteria, as I understand it, is that death has to be reasonably foreseeable. I believe that in the legislation, there's no time frame that needs to be adhered to, but a patient has to be on a trajectory towards death. And that will be determined by clinicians such as myself. So every case is individual. It's been around for a while now, but it's pretty new to me, honestly, now.
Well, it may not be what I end up going with, but I'd really like to have more information about it before I take it off the table. I want both of us to be okay with my choice.
Well, I can certainly look into it further. What I can tell you right now is that you can always change plans about what you want to pursue, and whether that be palliation on its own or with the addition of MAiD. You always have the choice, Helen.
Okay. Well, could you find out more about MAiD for us?
Yeah, of course I will. I will tell you, it will be a new experience for all of us, so we can work through it together. I'll call you as soon as I have some things put together. Okay?
Thank you very much.
Thank you.
Cancer is the most common diagnosis. But as Helen noted, it could be a host of conditions. Island Health's internet page has up-to-date information and links to support end-of-life care. Dr. Gill will find what she needs here. We'll look at this a little further and a little bit later. At this time, I want to note that clinicians are not obliged to provide MAiD. This said, if they themselves are not comfortable with it, they must provide an effective transfer of care for their patient to another care provider who is comfortable. There are resources available to help healthcare providers and clinicians clarify their own values. For instance, the Alberta Health Services created this self-assessment tool which takes an ethical approach to the subject.
Are you sure you'll be able to go through with this?
No, I'm not sure at this point. That's why I asked her to look into it for us. What about you, though? Would you be able to handle it?
I don't know. I'm still coming to grips with thinking about living without you, and you want me to think about losing you even sooner?
Yeah, I know. But the bottom line is you will have to learn to live without me at some point. I just keep thinking about, the future and what it holds for me with the pain and possibly the indignity of you or someone else having to bathe me and clean me up after the washroom and the whole loss of my independence and all that stuff that makes our life together so meaningful to me. And I keep thinking about Sue Rodriguez, and her whole fight to control what happened to her own body. I had to watch Cece die horribly with pain and unable to breathe. I don't want you to have to go through that with me. I don't want to be a burden to you.
You can never be a burden to me. I'll be there for you every step of the way. I would make it as comfortable as possible for you.
I know you would. But there will come a point where you can't make me comfortable anymore, where I won't be me anymore. I don't want to reach that point. I don't want to linger on in a shell of myself. I want to go with a good, clear goodbye while I can still say goodbye.
Well, this is your life. This is the hardest thing you've ever asked of me. But I love you and will respect any decision you make.
As Dr. Gill pointed out, the condition does not have to be terminal, but the patient must be on a trajectory toward death. Helen and John have talked, and Helen has made her decision to pursue MAiD. This is followed by the first of 2 assessments. These assessments can be made by either a family physician, a nurse practitioner, or a MAiD prescriber. In this situation, Helen and John asked to move forward with their family physician, Dr. Gill.
So Helen, the last time you were here, we talked a little bit about MAiD. Are you still interested in hearing about the steps involved?
I am.
Okay. So first off, you will need 2 physicians or nurse practitioners to be assessors if you decide to move forward. And I'm willing to be the first assessor if you want to proceed.
That's great.
Well, let's review maybe the steps involved.
Okay.
So firstly, to access MAiD, you have to ask for it both verbally and in written form. This here is the request form. This must be filled out and witnessed by 2 people. Once the form is done, 2 separate clinicians have to review whether you are eligible for MAiD. Shall we go through those steps now?
Yes, please.
Okay. So first, you need to be an adult over the age of 18 years old. Next, you have to be eligible for Canadian healthcare. I need to be also convinced that this is a voluntary request from you, that you haven't been coerced by a family member or another physician. You will need to have what the law calls a grievous and irremediable condition. The current law states that in order to have a grievous and irremediable condition, you must meet 5 other conditions. The first one is that you must have a serious illness, disease, or disability. This disease or disability must put you in an advanced state of decline of capability. That normally means that you are not functioning as well now as you were, say, about a year ago. That decline is irreversible by any means acceptable to you, the patient. Your suffering must also be intolerable to you. So that means suffering can be physical, such as pain, or emotional or psychological. And that's really all determined by your assessment. Your natural death, lastly, must be foreseeable in the future. So that doesn't mean that you have to be dying in a certain amount of time, but you have to be on your trajectory towards death. Now, the only other criterion that has to be met is that you have to have the mental capacity to make this request. That means that you understand your diagnosis and your treatment options, that you know what is involved in an assisted death and what your other options are, and that you have the capacity to make the request when you make it in writing. So according to our current laws, you have to have the capacity at the time of the request and on the day of the procedure. Okay. And lastly, as I mentioned, 2 different clinicians will have to agree that you have met all of these eligibility criteria. And then you have to decide if you want to go ahead with it.
So does that mean that I have to give written consent on the day?
Yes. As per our BC guidelines, you have to have the capacity to write that consent form early in the process and as well on the day of the procedure.
I'm just wondering, can we change our minds? I mean, say it's the day before, and we have a change of heart?
Absolutely, John. Yes, you can change your time at any time and we will stop the process.
What about pain medications and consent?
Good question.
Well, we would never tell you that you can't take any pain medications. If you think that your capacity is at risk of changing because of needing more pain medications or because of, progression of your cancer, then we can move the date up.
Okay. So who can be there when it happens? Can our family or friends be there?
Absolutely. You can have anyone or no one be there.
Okay. And where would it have to happen? Would I have to be in the hospital?
Oh, no. You can have it at home or, wherever your favorite place may be.
At home, for sure. I think in our back garden, under my favorite tree, is just the place. Now, I know you're just learning about this too. Are you okay with it?
Yeah, well, I'm working through my own thoughts and my feelings about this, but I'm absolutely okay with doing this assessment and going through the steps with you.
Okay, great. So what next?
So the next step is to complete the request form that I gave to you. You will need, again, 2 people to watch you sign and act as witnesses. And I have a booklet for you, and that walks you through the process.
Oh, all right.
This is the Island Health MAiD public website. It has links to information on hospice and palliative care. And from here, you can also link to both the provincial and federal MAiD resources. All the MAiD forms are available here from this link. Here, one can find the patient request record and the instruction for completion booklet that Dr. Gill just gave Helen and John. Here are the statements that independent witnesses initial and sign. Note that witnesses cannot have a view to gain, own or operate a facility where the person making the request lives, and cannot be involved in the direct provision of either personal care or the direct provision of the health care. In a few days, Helen returns with the completed witnessed form, and their conversation continues.
Thanks, Helen. Well, I do believe that you have met the criteria, and now that you've completed the request form, so we can move forward whenever you're ready. If you do decide to move forward, we will need to involve someone who will actually be the MAiD provider. Would you like us to move forward with the second assessment?
Oh, thank you so much for all of this, Dr. Gill. I want to keep going. Okay, dear?
Okay, if it's what you want.
My name is Dr. Stephanie Green, and I've been providing MAiD in Victoria since it became legal. I didn't go into this field because of a personal experience with a dying loved one, but because I think it's a natural extension of the work I do as a physician. I help people who ask me. At this moment, I've seen Helen, and I agree with her family doctor that she is eligible for care. So Helen, I agree with Dr. Gill, and I think that you are eligible for care now. So at this point, you don't have to do anything. If you want to wait and think about this longer, you can, but if you want to go ahead, I'm here to help you. So do you want to hear about the procedure?
Well, before we do, I just have a couple of questions. So what if we set a date and I'm afraid that my mind is starting to fail? What would happen then?
Yeah, so if your disease progresses or if you think your cognition is starting to change, you're not able to handle the pain anymore, things like that, we can always change the date. We can even move it closer if we need to.
Okay. And if I thought my mind was slipping, but I had a living will that says that I want MAiD, could it still go forward?
Well, just to be clear, I know Dr. Gill explained to you, you have to have capacity to make this choice when you request it, and you also have to have it on the day of the procedure. Nobody else can make this request for you, so we can't use an advance directive here.
Okay, well, that makes sense. Okay, so what would the procedure look like?
So let me tell you a little bit about it. Here in Canada, we actually have two choices. You're still eating and drinking, so you have both choices available to you. One of the options is that I can bring you a drink. We call it oral MAiD. I would bring you a little cup of medication that I would then give to you, and you would be in charge of taking it yourself and drinking it yourself. It's about a cup, just under a cup of fluid, and you have to drink it within 3 or 4 minutes. You would fall asleep about 10 minutes later, and you would get sleepier and sleepier, and then you would fall into unconsciousness, and you would die in about 30 to 60 minutes. Anybody who's there with you would just see you falling asleep. I would, of course, stay with you the entire time and make sure things go smoothly. The thing with the drink, to be honest, is that it doesn't taste very good. It's pretty bitter, so some people actually get nauseous. So I would want to pre-medicate you with something that would stop you from getting nauseous that day. So we could do that for you if you wanted. For some people, it's really important to be in control of that medication at the end, and that's a really good option for them, is the drink. Other people really don't want that or don't care so much, and for those people, I can offer to administer the medication myself. And I would do that not through a drink, but through an intravenous in your arm. I would actually bring a nurse with me to help me do that. And if we did it that way, I would actually give you 4 different medications. The first medication I would give you is actually an anti-anxiety medication. So you would feel really relaxed. Most of your symptoms would go away, and in my experience, pretty much everyone falls asleep when I give them this. If you're here watching, you'll probably see her fall asleep in about 1 or 2 minutes. So that can seem kind of quick, but you just fall into a light sleep. We'll probably find out if you snore. The second medication I would give you is a local anesthetic, just to numb the vein we're using to make sure we're not irritating you at all. Quite honestly, you probably don't need it because you'd be asleep, but I want to make sure that you're comfortable. The third medication I'd give you is pretty strong, and it's the anesthetic I would normally use to help you go to sleep for an operation, but it's a larger dose than normal. So you would go from that nice light sleep that you're in down into quite a deeper sleep and down into unconsciousness over about 3 or 4 minutes. In fact, if you were here watching, you wouldn't notice much except she's still sleeping, but if you were watching carefully, you'd notice her breathing starts to space out, becomes more shallow, and in my experience, almost always it stops during this medication. So we would expect that. But even though I know that that's going to work, we always complete our protocol with a 4th medication. The 4th medication makes sure there's no muscular activity in your body. So at that point, very soon after, your heart will slow down and stop. And of course, I would stay with you the entire time and make sure things are smooth and comfortable for you, and make sure that your family has all the supports they need. There's actually 3 things I'd want to emphasize to you right now. Number 1, you can change your mind at any time. You can change your mind after the forms are signed, even on the day I come to do this, up until the point that I ask if you're ready to begin. After that, once the medication starts, you can't stop. The second thing I would emphasize to you is that when I come to do this, it's with the intention to cause your death. I would come prepared to do that, even with 2 sets of medication in case something goes wrong the first time. And the third thing I want to emphasize is that you can do this anywhere that you're comfortable doing it, and you can invite anybody you want. You can incorporate any ritual or ceremony that you wish. Some people want music, other people don't want anything, but the point is, it's up to you. It gets kind of real when we start talking about the nitty-gritty. Do you guys have any questions about what I've talked about so far?
No, I think that seems clear enough, so thank you for that. Well, actually, no, I do have one question. Do I have to tell my family what it says on the death certificate, and how would this affect my insurance?
Yeah, good questions. Honestly, you don't have to tell anybody anything, but I'm going to take care of all the paperwork for you. When I fill out the death certificate, it will say that you had a medically assisted death. No one's really going to be seeing that form, but it is not it's not hidden, and so Vital Statistics will have a copy, and if someone in your family really wanted to investigate it, they could find out. But you don't have to tell them anything. Regarding life insurance, I get that question a lot. The truth is, MAiD is not going to affect your life insurance policy at all, but we'll get your family to check that your company agrees.
Okay.
Yeah. Do you have any other questions about the procedure or what's going to happen?
Well, not at the moment, I don't think. That was really very thorough. Thank you again.
You're welcome.
John, how are you doing with this?
I don't have any questions, but I'm not going to lie. This is pretty hard on me.
Yeah.
We seem to be discussing it like it's happening to someone else. I'll still support your decision, but it's going to be difficult.
Yeah, John, I think that it's kind of almost surreal to be having this conversation, I'm sure. And while my focus will be on Helen that day, especially, you should know that I actually think it's harder for those who are left behind. So we do actually have some supports for you, and I'm going to tell you about them. I've got a handout for you with some local counseling services and bereavement counseling, and I'd really encourage you to be in touch with them.
Good, thank you.
You bet.
Okay, well, I think I'd like to go ahead and set a date.
After the signing and witnessing of the request form, there's a 10-day wait period that has to occur before the service can be provided. As Dr. Green mentioned, this can be waived in exceptional circumstances. The 10-day period allows for consideration and is intended to contribute to confidence. This is a time for reflection.
I know this has been really hard on John, but honestly, once I made the decision, it was like a huge weight was lifted off of me. When I think back to the day in the doctor's office, when she told me that there was no more active treatment that they could offer me, I knew she was going to say that even before I got there for the appointment. I've always been like that. When my brother had a big accident, I knew the second that phone rang that it was about him and that it was not going to be good. So I think my subconscious had already made the decision for me, and it was really quite stressful until my conscious mind kind of caught up and made it official. So this is what I want. It's going to be in our back garden under my favorite tree. I'll see if the kids want to be there, but I think truthfully, I'd rather just have a little get-together the night before and say all our goodbyes. And that morning, I want waffles. Real honest-to-goodness waffles, because I'm gluten-free, and it really won't matter. I know that John is going to miss me so much. I know I'm still going to be around. I hope he takes his time in joining me, though.
I can't believe how hard this is. I know I've said it all along that it's her decision, and I still believe that. But I've been secretly hoping that she'd change her mind. I was so surprised when she first mentioned the subject with the doctor. But it makes perfect sense. She's always been one to do her own thing. Over the past little while, everything we've done together, I've been trying to burn into my memory, while at the same time trying to imagine doing it without her. It's driving me crazy. All I know for sure is that my heart hurts. I know it's nothing like the pain she's enduring, but mine's going to last a whole lot longer. And I know what she's going to want that morning. Waffles. I hate waffles.
I am early in my career as a physician.
And so I'm still working on developing my practice approach, shaping my professional identity, my values, and my beliefs. Which means I find myself often reflecting and sometimes ruminating on the decisions I make in a day. I am aware of how impressionable I am. When MAiD first became legal, I was in medical school. Providers around me shared a range of reactions, opinions, and moral, practical, and emotional perspectives. I valued tremendously their knowledge and experience, and in all honesty, could understand and relate to some extent at least with each perspective shared. So for months, I remained neutral and continued to passively listen to those around me to avoid what felt like a weighty decision at the time. I finally, one day, decided to take stock of what matters most to me. I realized it is the provision of care that upholds patient autonomy, dignity, and their own sense of self-worth. It became clear to me that MAiD is on the continuum of care that medical practitioners provide. And like with any treatment in medicine, there is true privilege, honor, and meaning in offering patients end-of-life care rooted in their own definition of life.
As I said before, I didn't go into this field of work because of personal experience, but because I want to help people. I believe strongly that a person has a right to choose for themselves what is best for themselves. For some, that means fighting with every ounce in them until the very, very end. For others, it's to choose to die at a time of their choosing, perhaps even earlier than others might have wished. Personally, I feel honored to be invited into that time and that space, into those conversations about death and dying, or more accurately about living and what it is about living that brings meaning to these people that I meet. I make sure that I follow the law, whether I agree with the law or not, and I am quite proud of my work. I feel privileged to be able to do it. Patients and families are incredibly grateful. Yes, it's emotional, sometimes pretty intense, but in case you're too scared to ask me, let me reassure you, I'm very comfortable with what I do.
My name is Adele, and I'm a registered nurse. I work with Dr. Green and other MAiD providers. My primary role is to establish an IV and access, and to support those in attendance. Helen is ready to die. She has chosen medical assisted death at home. In her backyard, under a blooming cherry blossom. The language around assisted death can sometimes be quite difficult. People who choose MAiD want to be in control of their life and death. We see all kinds of preparations and rituals for people who choose MAiD. Sometimes we join the entire family, many close friends. Some people want to be alone with their closest loved one. Some prefer to be quiet and restful. Some play their favorite music and almost have a party atmosphere, a celebration of life, a way to say goodbye. Many choose to be in their own homes, in a safe and familiar place where they feel comfortable. Others prefer the hospital environment. At times, people do ask to move their intended date earlier than anticipated. Symptoms do change. They've had increase in their analgesics, and they now feel it is time to go. Perhaps because of an increased fear and anxiety of losing control. Most are so relieved that they have a choice and can end their life on their own terms. They are very grateful and often express it openly. It can be very awkward to say, "You're welcome." I say, "It's a privilege to be here."
It's just going to be John and me. The family said their goodbyes last night.
Sure. Actually, this is a great opportunity for us just to speak for a moment or two before we invite John to join us. It's kind of important that we do right now. How are you feeling this morning about your decision to go ahead?
Oh, good.
Yeah, no change of heart then at the last minute?
No, not at all.
No. Did you get to say your goodbyes to all the people you wanted?
I did, yep. I wrote some letters, and I spoke to face, but I think I crossed all my T's and dotted my I's, and
Perfect.
I'm ready.
Well, let me tell you what's going to happen next. In a moment when we finish talking, I'm going to ask you to give me permission to go ahead today and sign a form. After that, I'm going to introduce you to Adele, who's come here with me today, and I'll step out while Adele starts your IV. During that time, I'm going to be speaking to John just to remind him what's going to happen and what it's going to be like, so I can answer any of his questions. I want to be as transparent as possible with him. Once everything seems complete, John and I are going to come back in here and join us in any place that you guys are comfortable to be and how you want to sit. And I'll make sure that he has a chance to say any last words he wishes to say to you, even though you've probably said your goodbyes. I'll still give him that opportunity. And of course, I'm giving the last word to you. So you can take it or not take it as you wish. Once that's done, I'll still ask you one more time if you're ready to begin. And until that moment, Helen, you can change your mind. Once you tell me you're ready to start, though, I'm going to start giving medication. And once I do, you know I promised you that I'm going to finish.
Okay.
Any questions before we start, then?
I don't think so.
Then I'm going to give you this form I have. And I'll have you sign that. Okay. Great. I'll send Adele in and I'll go speak with John.
Okay, thank you.
Sure.
Hi, Helen. Is it okay if I start your IV now?
Absolutely.
Are you comfortable?
I think so.
Okay. Are you ready? Mm-hmm. Gonna feel a little poke. Okay. Still feeling okay? Mm-hmm. So I'm just going to flush this with a little saline. Okay. Dr. Green will be the one to give your medications. Okay? We just want to make sure this is working really well and there's no problems. Okay. Is it feeling okay still? Mm-hmm. Perfect.
Oh, feel it going in.
Okay, Dr. Green, I think we're ready.
John, I think they're ready for us. Come on in. You can come in as close as you like. If you want to hold Helen's hand, you're welcome to. Whatever you guys decided is fine. Great. So before we do anything at all, I promise to just make sure we have a chance to say goodbye. John, I know you've probably said your goodbyes to Helen, but if you want, now's a good moment if there's anything else you want to say.
Just that I love you. I've always loved you. And always will.
Helen, is there anything you want to say to John?
I've got some things to say. So first of all, I'd really like to thank the three of you because you've made this process so smooth and you made me feel like I was listened to and valued through all of this, so thank you. Now, John, Kleenex here. I won't ever be far away. You were my life and my love. Thank you for coming along on this ride with me, right to the end. So please stay. I want you to be the last thing I see.
Helen, are you ready for me to begin?
Yeah.
Okay, you can look at John, that's fine. Don't mind me over here. I'm going to start by giving you a medication in a moment that's going to make you feel really comfortable and probably pretty sleepy. You can look at John. And if you want, you might want to just think of a memory of a time when you were younger, maybe healthier, and doing something you really loved, with someone you loved doing it with. And go right to that memory right now as I give you this. And enjoy that memory. If you feel sleepy, you can close your eyes at any time. We're all going to stay here with you, Helen. We're going to make sure everything's fine.
Now the death has happened. The family calls the funeral home. The physician debriefs with the family, does the paperwork, and plans for supports afterward. Then, once they are sure that the family or support persons are going to be okay, the physician and nurse leave the home. The funeral home soon arrives to pick up Helen. We are all born, we all die, and in between, we have but one precious life to live. Today, like never before in Canada, we have more options available to us at end of life. Options like palliative care, and now, in addition, in certain circumstances, we can choose an assisted death. This new reality has sparked conversations at kitchen tables and in coffee shops, and certainly in the media. People of all ages are having early conversations about their hopes, fears, and wishes. And this is a good thing. People are sharing stories and experiences, and we're seeing new dying and death rituals emerge. We hope that this simulation of a profound moment has helped to inform and shine a light on the current state of assisted dying, and that it will generate further meaningful conversation. At this point, would give me a great honor to invite our exceptional cast onto the stage. I would like to invite Barbara Metcalf. I would like to invite Brian Marsh. I would like to invite Dr. Shelley Chopra, Dr. Stephanie Green, and Adele de Rosenroll. Thank you all very much. And my Roseanne Youth, and I'm the coordinator with Medical Assistants in Dying. And now I would like to introduce Darren Abbey, and he will continue to narrate.
Thank you, Roseanne. I'd like to now walk us through the process of this debriefing. So let me first reaffirm that this is totally voluntary and confidential. First, we'll spend some time considering our current reactions to this evening's events. And then I'll provide a high-level summary, and then we'll break into smaller groups. And our facilitators will help us to have the conversations about what's top of mind and what, if anything, was surprising. We'll then discuss the possible impact of this event. During these conversations, our scribes will be taking anonymous notes to capture the sentiments in the room. To close, we'll then reconvene and hear a sample from each of the groups. So let's start with a few moments in the reactions phase. At this time, I invite you to privately pause and reflect on the evening's event. How are you feeling during the simulation? What were your thoughts? How are you feeling now? Thank you for that. I'd invite you to come back into the room and let's sort of transition to a little more of a discussion, a bit more of a conversation. So I'd like to provide you with a bit of an event review. Please allow me to remind. There was the ask, where Helen and John found themselves talking to Dr. Gill. There was a time after that, after the ask, where Helen and John kind of worked through it together, for better or for worse, as they say. And then there was the process of the first assessment. And the second. And then we had some times for reflection from our cast. and then, of course, the MAiD experience itself and after MAiD. So what I'd like to do now is, again, group into small groups. And let's ask our facilitators to gather 3 groups. We'd imagine we do these in rows. The first 3 tables together, the middle 3 tables together, and the back 3 tables together. During this time, we're going to really try to stay on track. We're going to facilitate the conversations. Again, everything that's captured is anonymous. And we want to stay in the room this evening, not reflect too much on other events. And we really, really look forward to hearing your thoughts. So can I invite one of our facilitators to come on up? I'm going to ask all 4 of you to come up. So George, it looks like you're on your way. So George, please share some of the thoughts. And again, I'll remind everybody, these are anonymous. And I've asked the facilitators really just to share some things, maybe to share sort of the scope and breadth of some of the conversation. It's by no means privileging one thought over the next.
Are we doing this one at a time, or all facilitators? Absolutely. I'm George Shepard. I'm an emergency physician in Nanaimo. I've worked with Darren for a debatable number of years. Thank you for inviting me. This has been a pleasure. Our discussion focused around the presentation and the questions that we're having to address. The initial and most common comment about the presentation was that although it was a very good presentation, it seemed to be very idealized, that it's a very not simple, but a standard presentation of a patient going through the entire process, which was educational, but it seemed to be, there wasn't any discussion about, family strife or concern or the stuff that one would expect for, a family member flying in from the coast and trying to put a stop to the entire thing, which could happen from time to time, and I think for the purposes of the presentation, not really necessary because it generated the discussion. The second point is now eluding me. The second point that we were discussing was the impact on the possibility of a patient who presents who's not necessarily wanting to be participating in MAiD, but maybe under a bit of coercion from family to do something, and the possibility of the process having complications or ethical or moral problems from the other concept, and how does a physician or a provider deal with that type of stuff. The last one, help me out. What was the last one? Who raises the issue? That's right. That's correct. So we discussed a little bit about whether it was ethical for the provider to introduce the issue of MAiD to a patient who's there, or whether it should be something that we should wait until the patient asks for it on their own themselves. And we discussed that back and forth a little bit, and we decided that it depends, that the best answer to the situation is it really depends on the situation. A provider who has a great deal of experience with the patient, over a 25-year period of being their family physician, might know the patient much better than someone who's just recently been transferred into their practice. And so I think that answer is best left up in the air, because it's not something that necessarily needs to be answered. It could be either way. So those are the big topics. And last point was that the presentation was a wonderful way of opening the discussion, but the debriefing really seemed to settle down, and we had a really good discussion about that. And actually, I think most of us agreed that the debriefing was probably the more valuable component of the evening. So thank you for having us here.
Thank you.
Hi, my name is Amanda Adams. I'm the clinical nurse educator for the Jubilee Emergency Department, and I have been working with Darren in debriefing skills for the last 5 years, and thank you for having me today. It was a really excellent event. Our group really talked about how respect came to top of mind. This was a very respectful process, and it felt comfortable. And in that, it brought out the questions around what happens with family that goes along with the patient's wishes but might not feel good about it when they leave, and what kind of supports would be available for them to have these big debriefs and to have the discussions, because this was sort of like the ideal event. Everybody just, it went smooth. What happens when it doesn't? So that was something we talked quite a bit about. And the other thing that really sort of popped up was about us as healthcare providers being involved in the process and not feeling comfortable with it. And how do we, come to learning and come to a place of being able to support our patients either with making referrals or moving through the process with them. And so how the event impacted, a couple of our participants talked about how they came in not necessarily knowing a lot of the process, but being able to see it in a simulated environment is hopefully going to make them feel more comfortable moving forwards and being able to support family and or their patients.
Hi, everyone. My name is Joni Litchfield. I'm a nurse in Nanaimo Emergency Room. I've been doing clinical simulations and debriefing with Darren for the last couple of years. I work for the UBC Faculty of Medicine doing some simulation with them as well. So that's why I'm here tonight, is to help with the debriefing. And we had a really diverse group of people at our table, so I think we were really privileged in that. One of the first things that came out as being top of mind for us was the dignity that was associated with this process that really stood out for everyone. And it was also mentioned in our group that having a well laid out process was a very comforting and reassuring option to have there, so everyone could feel reassured that although this is a very emotional process, there were multiple stops and checkpoints, and it felt like a lengthy process where there were multiple checks and balances in place where people could have the opportunity to have their questions answered or to change their mind. And there was also discussion about the clinical nature of what's happening here. And a lot of people mentioned that they hadn't really thought about that aspect of MAiD. They had thought about it as the emotional side of death, but they had not thought about, there's an IV and there's medication and there's oral medications, and if those don't work, there's an IV later. And so those kinds of thoughts also came out. So there was a little bit of discussion about the logistics of the whole thing and an appreciation for the understanding of what the process really is. And there were a few people that were surprised as well by how the process went for the family member. And I think this is what some of the other tables discussed as well, where if you have a family member that's not on board or that's struggling to cope, and the care that's offered to them. So we did talk about the care that is offered to the family members throughout the process, and then also the aftercare, that the person isn't just left at home all of a sudden going, now what? So those are some of the things that people were appreciated seeing in action. So anything from my table that was a really important point you wanted to add? No? Thank you.
Hi, I'm Tamara Young. I'm the acting manager at the Center for Interprofessional Clinical Simulation Learning. I had the privilege of working with a table of cast members. I would say there was probably 100 things I could comment on that were important and very powerful that I heard from this group. Things I would highlight, the word empowerment and powerful came up a lot. One thing that stood out to me was speaking to how through this process we're empowering that patient, and that there's almost a relief of tension once they have this power. Once they're given this control over their decision, there's a change in the patient. Those tensions are lifted, and how surprising that is and how important that is. Another thing that was really resonating with our group, I would say, is just changing the way we look at death, how death is viewed, how death is always, part of life, but now taking that and looking at the quality of death and what that conversation looks like. And I would say that there was a lot of reflection, especially as practitioners, but not just as practitioners, as individuals who have maybe had family members go through painful experiences with death in the past, and the emotions that this performance elicited with those experiences, and just the thought-provoking. So, unless anyone had anything else to offer, thank you.
Thank you. I'd like to just call out our crew. and some of our collaborators. Thank you. It's really been a pleasure to work with you all on this event. I've listed some people here. There are others, and I'm just really happy that when I pitched this to Roseanne, she said yes. So thank you. Before we call it a night, I really do want to invite you to share the feedback that we have provided you with. There really are two ways that we're hoping you'll do that. There is, as you probably noticed in your brochure this evening, something for you to write on, and we really value your opinion. It is anonymous also, and we'd really love to hear your thoughts. You'll also see in the brochure that there's an envelope with that's stamped with our address on it, because our hope is that, and what we know to be true, is that this stuff, like all learning, it doesn't end just because it's like the end of the learning time. The ongoing reflections are really where the magic happens. So our hope is that a week from now, you'll take a few minutes of your time, drop a few things down, and put it in the mailbox for us. And I'd really be happy if I got one or two of those. So we really look forward to seeing that. Really appreciate your comments. Again, everything's anonymous. So lastly, the only thing I have to say is thank you again. Pleasure.